Welcome to the Orthodontics in Summary podcast, where Farouk brings you the key points and understanding of orthodontic webinars, conferences, and papers in a concise podcast with your host, Farouk Ahmed.
Hello all, and welcome to another episode. Today, we're looking at the lecture entitled How to Align Lower Incisors with 2D Lingual Appliances by Nicolas Salesse from Vietnam. The lecture was split in two ways. The first half went over 2D lingual appliances, their function, their use, and some strategies, and the second half went from beginning to end of the treatment protocol for 2D direct lingual appliances. He started off by giving the advantages of 2D lingual appliances. They are direct bonding appliances, so it's straightforward to carry out. They're unlikely to debond when compared to 3D lingual appliances, and that's due to their low profile nature. There's no complex bonding required as it is with 3D lingual appliances. The prescription is 0 degrees for the bracket, which means that there's no torque entailed into it. Treatment can therefore be conducted from beginning to end on round wires, knowing that we're not working towards any rectangular arch wires. He spoke about the cost of these appliances. There are two brands that he uses. Forestadent charged between $10 and $20 per bracket, but a Chinese company called Headway charged $2 per bracket. And at such a price, I know for myself, that probably equals the price of some metal brackets, but also some ceramic brackets on the labial face. He also spoke about the issues with 2D lingual appliances. One of those being how the metal itself can deform when the bracket is open and closed. He said this is less likely due to the low profile nature of the brackets. He also said that the caveat he has when it comes to managing patients is that he may carry out some aligner therapy at the end of his lingual appliances. Now he went back to the lower arch and said why this is advantageous. The lower arch bracket positioning is much more straightforward than the upper arch. Now he gave reasons as to why. The lower 4 incisors are of the same height, so therefore bracket positioning is the same for those lower 4 brackets. The lower incisors are relatively upright teeth, requiring no significant tip as part of the aesthetics. He then spoke about the upper arch, where things are different. The differences in the vertical height of the central and lateral incisors means that the bracket positioning needs to be offset in the vertical dimension to achieve our ideal aesthetics when it comes to smiling. And that means altering bracket positioning or putting a bend in. Either way, it increases the complexity associated with upper arch treatment. And he described how patients' expectations are lower when it comes to the lower arch, and therefore it's an ideal way to start off with 2D lingual appliances. He then went on to describe the general challenges associated with lingual appliances and how to counter them with a 2D direct bonding approach. There are 4 main challenges when it comes to lingual appliances: the reduced inter-bracket distance, the in-out discrepancy on the lingual aspect of teeth, bracket positioning, and also the prescription. So the inter-bracket distance is a challenge. The reduced inter-bracket distance in comparison to labial brackets means that the wire is stiffer, and therefore greater force is elicited. He described how in 2D brackets, the wire can simply be placed above the bracket, more incisal as it were. Therefore, the inter-bracket distance is increased. And this is similar to how incognito, the 3D lingual appliances work. He then went on to describe the in-out discrepancy. And this is based upon how, if we have lingual fixed appliances, they are ideal at aligning the lingual surfaces of the teeth. However, this results in a discrepancy in alignment in the anterior-posterior direction on the labial face. He also mentioned how, by having lingual appliances, we are further away from the labial face, the surface that we're interested in. So therefore, we have less control as we would do if the appliance was fixed on the labial surface. He then went on to describe the height positioning of the bracket. If we position the bracket on the lingual surface as incisal as possible, we therefore minimize this anterior-posterior discrepancy. Also, anatomy is far more predictable the more incisal we go. He mentioned how the lower 2 to 2, lateral to lateral incisor are at the same height, and therefore there are no bends required when using 2D lingual appliances in the 2 to 2. He contrasted this with the upper arch, where the central and lateral incisors have very different vertical heights but also anterior-posterior dimensions. Consequently, vertical and AP bends are required to achieve ideal alignment in the upper arch. He also described how in the upper arch the slots are usually located for lingual appliances further gingival due to occlusal factors, and as we understand, the further gingival we go on the anatomy of a tooth, the greater the anterior-posterior size, and therefore we're further away from the surface of interest, the labial surface, we're more likely to have an error taking place. The fourth factor was of a prescription, and he described having a 0-degree bracket is ideal, and we can therefore put in a simple bend between the lateral and canine teeth to carry out the lingual appliance, and this compensating for the AP discrepancy between the lateral incisor and the lower canine. Now then he described the protocol of bonding these appliances. The caveat was this was just for lower arch alignment. So initially he started off with a digital setup to check for the amount of IPR required. He would then bond the brackets directly lower 3 to 3, as close to the incisal edges of these teeth as he could. This increases into bracket distance and we're less likely to make an error. Interestingly, he mentioned no overcorrection for alignment for this segment. He then carried out his IPR. Now he gave a clinical pearl. He mentioned when bonding the lower canines to bond the lower canine to the lower first premolar with composite, and this prevents any adverse rotational effects taking place on the lower canines. His wire sequence, initially he'll start off, interestingly, with an 012 Nitai wire, a straight 012 Nitai wire. He would carry out his stripping, and he said this would allow the lower arch to procline to some degree, which helps with alignment. He would then move on to an 016 Nitai. He described putting bends into this wire between the lower lateral incisor and the lower canines. Then he would go into then detail and finish the case from there. That's it for this episode. Hope you've enjoyed it. Please do subscribe and stay tuned to the next episode.